think both Frank and I see fame is sort of bigger than us, and certainly not just about us. Fame is sort of the outcome or the result of he and I going through a life-altering experience and deciding that we wanted to contribute back in some way. I think it exists because it's meant to.
Actually, when we first decided to move to Tanzania, our plan was to do this whole medical project in Arusha. And all this while, India, our friend with the orphanage, had been kind of strongly hinting that we should move our project to Karatu, that there was a real shortage of doctors, and she wanted us to take care of her orphans and all that. So finally, about 4 years ago, we sort of just surrendered, gave in, said, okay. The long-term plans for fame is to get, this part here finished, where we are now, this 20-acre fame compound, which will eventually involve, the outpatient clinic, which we're running now, hospital, nice lab, housing for staff and volunteers, and then sort of expand from there.
I'm Caroline Apa. I'm the volunteer coordinator, and I've joined the team about 4 months ago and have been immediately welcomed into the team, which is, says a lot about the staff members here. We've got Sienna, who's our head nurse, who's a nurse officer, and she's been working with Frank for a long time as well. Mama Shana and Sienna are in the pharmacy usually where patients buy their medication. Mama Shana works with the surgeries as well. She does a lot of the injections and also setting up other procedures for Frank or Dr. Mshana or Ivan.
It sort of strikes me over and over again how you can totally change the quality of their lives just by, using our very simple 100-year-old methods of a stethoscope and talking and touching and feeling and the old-fashioned way. Probably the most common things we deal with here, of course, depending on the time of year, malaria is always a huge thing, and it's one of the most dangerous things. It's one of the diseases you can easily die from. But probably the most common things we see and deal with here are just common infections, whether they're upper respiratory infections, urinary tract infections. These people will have 3 or 4 of them going on at the same time. And you'll ask them, how long have you felt kind of bad? And it's like, well, several years. Some of these people I don't think even know what it feels like to feel good. The vast majority of people we see out in the mobile clinics, where we take the team out into the bush where there's virtually no medical care, very little medical care around, almost every patient comes in will have 2, 3, or 4 major diseases. When you think about practicing African medicine, that's kind of what the mobile clinic is like. It's, it's out in the bush where there's nothing around and there's no electricity and there's no running water, and it's really back to basics. It's rough though, For a long time when we first started doing it, we had no lab, so we were basically just treating, kind of running by the seat of our pants and using purely clinical diagnosis. Now we are able to go out with a full lab, which has been a godsend. And volunteer doctors we've had come absolutely love it. Over and over again, I've had them say that that's the experience that changed their lives. You just go out there and you see so much need, so concentrated in such a big dose, and you're able to help these people. We go out there now with a drama troupe that's based here in Karatu, and they actually do this live theater that's amazingly entertaining and also very educational on malaria, sexually transmitted diseases, basic hygiene, hand washing, spousal abuse. So when we go out on these mobile clinics, there's always crowds of people around waiting either to be seen or waiting for lab results or whatever. So we have sort of non-stop educational stuff going on. We're working on getting an outdoor projection system so we can show Kiswahili educational videos that will entertain and also educate people.
It was a great experience. The second day is a lot different than the first day. First day I was really emotional. I just found myself welling up. Today was more about just helping treat the people. It's been the most gratifying work that I've ever done. And I don't know how I'm ever going to forget this experience or not do something to build on it in the future.
My name is Ivan Mwaruko. I'm just a treating patient at the mobile clinic. Seeing people with problems, most of them are malaria patients, brucellosis patients, and those with respiratory infections. They say, we are feeling better, keep on coming.
Dr. Frankie can say that he is a wonderful person, himself and his wife. When I met him, I have been working with him for all this time, and he's really very nice to the patients, even to other people, especially those who are suffering, especially poor people. She's really a person who many people are talking about him and his wife.
I think what we offer and what the attraction is for medical professionals here is we have a supportive environment. We have resources. The pharmacy is always well stocked. We have opportunities for consultation with specialists from the U.S. When they come to spend some time as visiting docs. And I think that those are really the kinds of things that attract people to this particular organization. Again, we are in a rural area, so we're dealing with a lot of people who either don't have work or maybe make $1 or $2 a day. You know, we're charging for a consult with the doctor 1,500 shillings, which is like $1.50. But you know, a lot of people are leaving the doctor's office for 7,000 shillings or 13,000 shillings, which for us is what, a couple of cappuccinos. But it's virtually unaffordable for many of them. So.